All right, so we are on our fourth stage. So we've done engagement, data collection, assessment, and now we are in the intervention stage. And so, what exactly does this mean? So, the whole goal of the social work intervention, so during the stage, is this is kind of this like little catchphrase, is to facilitate empowerment transactions. Those are really big words, but I think it really captures the kind of the essence and the vibe of what interventions are really tailored to be. So it's really kind of focused on the client systems, whether it's your individual client. Sometimes, as we'll talk about in later slides, when we talk about indirect interventions, you're doing an intervention for more of a system or a group or the macro setting. So interventions don't necessarily have to be specifically to just an individual. There's different ways we can implement interventions. We'll focus a little bit more on the direct interventions because those are the ones related to individuals and families. But anyways, that's a little bit of a tangent. But we're looking at enabling people to overcome the conditions that keep them from participating in the benefits of society. And so an example of that would be if an individual was experiencing depression and anxiety, well, they are going to have obviously some negative experiences possibly with engaging in society. And so something is preventing them from being able to engage purposefully or however they envision themselves. And we have to remember that sometimes our end outcome for interventions might look a little bit different than what a client's perception might be. So we do have to keep that in mind in creating interventions. And that does kind of tie into goals as well, that we don't necessarily want to identify the outcomes and tell them what to do because our perception might be very different. So interventions are just finding ways to empower and enable the people to overcome whatever barrier or life experiences that are occurring that keep them from participating in the full benefits of society. So if you're thinking about that on a macro level too, that could be like a policy change, is that something is preventing a client system from engaging fully. And then the second part was finding ways of meeting their needs so that they may develop and function within their environment to the best of their potential. Again, best of their potential and best of their desires and beliefs, not what we assume that they want to accomplish as well. And it's really important when thinking about interventions is that at some point the social worker is no longer going to be a permanent fixture in their life. And so we need to empower the individuals to be able to manage their symptoms, their problems, their issues, however you want to define it, independently on their own. And so short-term therapy might be the way for the individual to manage their depression and anxiety, but at some point they might not have a therapist, and the therapist isn't going to be with them 24/7, so they have to be able to develop coping skills, develop ways to manage their life so they're able to engage to the best of their ability. So interventions kind of look at all of those pieces. A really kind of good way to look at this, since we're talking about the stages and sequencing, is if we're here at interventions are based on the goals and the plans of action that were developed in the assessment phase, which is based off the information gathered during the data collection phase, which is gathered by forming a trusting therapeutic relation in the engagement phase. So this is really showing why this is like a sequential method of social work practice, because you kind of have to do all of these steps in order to get to be able to get to a place where you can give the client tools. You have to engage with them. You have to know what's going on with them. You have to know what's important to them in order to help get to this point where we're starting to finally kind of feel and experience and promote change. Social workers are agents of change. I forgot that we do all these very action-oriented roles within our clients' lives. It's just a fun slide. But this is one that I really want to highlight in this video, is that we talk a lot about power dynamics in social work and kind of how, as social workers coming into the situation already, we're already sitting at a position of power because we're the helper in the helping profession. And so we need to be very, very cognizant about how that role of power is viewed and can be utilized. And the best way to kind of combat some of the power dynamics, also to encourage the client themselves to take ownership and to kind of be their own agent of change, is figuring out ways to empower the client. And so kind of breaking that down a little bit, power shared relationships is where the client is seen as the expert. That's very strength-based. It's very client-centered. So we're looking at asking the client what they want to accomplish. And again, we sometimes have to have some input because of our clinical expertise, or we might have an agenda we absolutely have to abide by. So like if, you're a case manager and the client has a guardian and the client wants to move out of the adult foster care home, well, we can't necessarily always implement that change because the guardian has a final say. It's clinically necessary for the client to be there. They have limited insights they don't know. So we do have to be mindful, like our role sometimes requires us to have some sort of say, but then we have to figure out how to empower our clients within that situation. So you really want to look at the equal power in relationships, especially just being mindful of diversity, some of our own personal biases that we might be taking into relationships, biases our clients might have. It can be a huge barrier to motivating the client towards any sort of change. So we really want to build interventions that match the client's motivation, capacity, and opportunities for change. So if you are working with a client who is consuming a large amount of alcohol and they have no desire to change, setting their goal as become sober in the next month is not matching their motivation. They probably don't have the physical capacity even like to be able to withdraw, detox, kind of go through some of that biological issues with becoming sober from substances. And is there opportunities for change? Like, are they going to be able to completely change their environment in a month to be able to reduce the potential triggers for relapse? And is there enough supports in place for success? Now, it possibly could happen. I've seen it happen. Client gets uber motivated right away, and they're able to kind of do a quick change because of some sort of motivation. But again, that goes to motivation. It doesn't, you have to match where the client is at. If the client is unmotivated, creating a really lofty goal that they don't care about, and then finding interventions to meet that goal isn't really going to be productive, because if the client doesn't have a buy-in, it's really hard to motivate or actually see any change. And so you assist the clients in gaining information about the problem in hand and equip them with the skills for taking action. So when I was on the previous slide, a couple slides ago, talking about how you want to give the client the tools and the ability to manage their symptoms or problems or issues on their own, because we're very cognizant that termination is coming down the road. And so we have to empower them with the skills, able to take action. We can't just tell them, well, go do this or go whatever. We are in that role. If we go back to our roles, is, we're an advocate, and we're an educator. We have to give them the tools and means necessary to be able to accomplish whatever their intervention might be. So that is kind of an introduction to what intervention is. We are going to have another video talking about direct and indirect interventions, because that'll kind of break down specifically what interventions look like, because we're kind of talking about them very broadly right now. So we'll kind of specify them in the next video.